If you would like, I can go through what our INF, which is Individual and Family Portal, where you'd submit the application. So as you all know, nothing has changed from last year. Tobacco, rating area, age, and single or family is how we are determining the rates for this year. Again, that hasn't changed at all. Essential health benefits, all of these must be in all of our plans. All of these are embedded into our individual and family plans. The bronze, silver, gold, and platinum, we had to follow this actuarial value. Again, for this year, and as you may notice, between carrier to carrier, you don't find a lot of difference between the different plans or even sometimes the rates, since we all do have to follow the same guidelines. As a reminder, whenever it comes to the out-of-pocket maximum, the ACA is requiring all non-grandfathered plans effective this year to have a single out-of-pocket maximum. So really, though, it is now a true out-of-pocket maximum because it is going to include your medical, pharmacy, mental health, pediatric dental, and pediatric vision under the essential health benefits. And all the expenses that are included are deductibles, co-pays, and co-insurance. The out-of-pocket maximum is tied to the IRS out-of-pocket maximum. So they did change this year. They are now $6,600 for an individual and $13,200 for a family in 2015. So they did go up slightly from last year, or we're still into this year. So the important things, the 2015 individual plans for UPMC. It took a lot of the feedback from all of our producers for our 2014 plans, what they liked, what they hated, what they would like to see. So one thing that we did here that they want it to be simple. They don't need a lot of plans to choose from. They just want to have, a certain amount of plans. They understand them, and it's not difficult. So we are now going to have 9 plans, but we're also going to offer 3 different networks. So how it's going to go, a potential client, they're going to first choose what network they're looking at, and then based on where they're living and the different type of providers that they do need, they're then going to choose their plan that best suits them. So the 3 networks that we are offering is the premium, which they will be PPO plans, the select network, which will be EPOs, and the partners, which are EPOs as well. And I will get into detail in them in the other slides coming up. One thing that we took back from the 2014 year is that HMOs were not popular whatsoever. On the individual side, between the restrictions, some of the doctors or hospitals were not participating within the HMO network, having to have a PCP, the referrals. Even though we reminded the producers and all of our clients this is how the HMO is working, they either forgot or they weren't told correctly. So we figured an EPO, we've always done very well with EPO plans here at the health plan. And it basically works like an HMO, except it doesn't have the restriction of the referrals, having to have a referral to see a specialist or having to have a PCP. And the 9 plans that we are offering are going to be 2 bronze, 4 silver, one of which will be an HSA, 2 golds, and 1 platinum. And another thing that we took back from our producers is that we needed to keep things simple. When it came to the plan names, it was confusing. They couldn't figure out, which plan was which. So the way it's going to be laid out is going to be the metal level, the deductible, the PCP copay, and what network they selected. So I believe this is going to be much simpler this year. So the first network that we are looking at is going to be our premium network. This is our 29-county network for our PPO plans. This will be our broadest network. It includes all of the UPMC providers and UPMC-owned facilities, as well as many of our independent providers and facilities as well. So that's something to keep in mind, especially like I was talking about the split with us and the Highmark beginning 1/1/15 is that, if you are worried about where to go, there are independent providers and facilities out there that are not owned by us or Highmark So as long as they have admitting privileges for whichever carrier the member goes with, then that might be a simpler choice. So with this type of network, they would be able to do that. And with this, they also have the comfort of having the out-of-network coverage. They do have to keep in mind that out-of-network is much more expensive. Their co-pays will not kick in. It will be co-insurance. You end up paying a lot more with your co-insurance. And there's even different deductibles and out-of-pockets you would have to meet as well. So like I said, this premium network is our broadest network of all three. And also keep in mind the fact that it's probably going to be our most expensive one, since it is all 29 counties. They do have the out-of-pocket net on these types of plans as well. Our Select network. We offered Select plans last year. They were with an HMO, but this year they will be with an EPO. So if you have a resident that resides in either Allegheny, Beaver, Butler, Washington, and Westmoreland County, they're eligible to be in the Select network. And with this, will include the UPMC providers and UPMC's own facilities, as well as some of our community partners like Heritage Valley Hospital, Butler Memorial, Monongahela, Excella Health, and Washington Health System. So something to keep in mind is that St. Clair Hospital is not within the Select network. It is not owned by us or Highmark, but they have elected not to be into this network. So if anyone is familiar with the Mount Lebanon area, Green Tree, Upper St. Clair, this area, a lot of them would go to St. Clair Hospital. If they have this network, it is not part of it. So with our networks, especially the Select and Partner, it's going to depend on what rating area that you live in. So this will be less than the premium network, but it'll probably be more of our middle of the road pricing as far as networks are concerned. And our partner network is new for 2015. The member must reside in Allegheny or Erie County, and plans offered in this network are the least expensive. So this is our much more narrow network. In this network, it includes the contracted UPMC providers and UPMC facilities. And in Northwestern PA, there are a select number of independent providers and facilities that are included. So like any time when it comes to switching someone to a different carrier, I think it's very important to check all of their providers and facilities that they go to, and just make sure that they are within in the network. So with this, make sure you check it so there aren't any problems later on down the road. The partner network will be EPO plans, and even if these individuals are residing in Erie or Allegheny, they are also able to purchase the premium network, but with this, they can still receive care from the 28 county service area. So even though they're just living in Allegheny or Erie, if they're up at their camp and they're in Clarion County and they need to go to the hospital there, they would be able to receive care there. So that is kind of a benefit with this one as well. And here we're just showing that we have all the plans, and all the plans are also going to be available on and off the exchange. So again, it's not going to be complicated where you'll have some that are on the exchange, some that are more that are off the exchange. We wanted to make it simple. A plan that was added as far as is only in the premium network would be our catastrophic plan. And again, I will be going through the different plans shortly. But as you can see here, again, you would pick a network and pick a plan. Some of the things I do want to point out as far as our plans, we have something called e-visits or UPMC Anywhere Care, which I really like, and we are trying to promote it as much as possible. So whether I'm at an enrollment meeting or talking to my different producers, I always try to mention this. Since everyone seems to always be, concerned when they're traveling or what happens if they're sick in the middle of the night, with UPMC Anywhere Care or e-visits, they're half the cost of a primary care visit. So if, your primary care, your PCP visit is normally, $20, you're only going to pay $10 for this. if you would have an HSA, they don't normally have copays, the most you would pay is $38. So this is cool. It's a 24-hour service. It's online. I've actually gotten a lot of great feedback on this. You know, one of our producers, they're also members of ours, and he had a sinus infection. And he gets one every year. He knows the symptoms, so he logged on. He just gave a brief description of what was going on. And within 7 minutes, they got back to him and said that they already sent a script to his pharmacy for him to go and pick up before he was leaving on a business trip. So if you want your PCP, it could be up to a 24-hour turnaround time. If you just pick any PCP, it could be around 30 minutes. It honestly depends on how busy they are and what time of the day it is. You know, if your kids get sick in the middle of the night, you can do this as well. Have it sent to have a prescription sent to the pharmacy, things like that. So, you know, a lot of the basic, you know, sinus infections, a cold, nothing serious. Obviously, if it's a true emergency, go to the ER, or if you really feel like you need to see your PCP face-to-face, then do that as well. But it's also good for traveling. Our Advantage Choice formulary is our generic-driven formulary for our individual plans. They offer $0 generics for oral cholesterol agents, hypertensive, non-sedating, anesthesia. I'm sorry, I cannot pronounce that word today. I'm having a hard time. Protein pumps inhibitors, and antibiotics. So that's nice. So it kind of is a 5-tier, but it really is a 4-tier formulary. Since it is generic-driven, we do really try to have our members go to the generics since it is a lot less expensive. Again, if you're unable to, you might have to go through a step therapy to show what you can and cannot take. Some might have prior authorizations, things like that. There are cost shares associated with each RX depending on their medical plan. Pediatric dental and vision for children that are under the age of 19 are included in all of our plans. So if a child under the age of 19 at the time of enrollment, they will be eligible for the pediatric dental and vision. If they turn 19 during their benefit year, this will not change for them until the renewal. All of our plans, like I said, it's embedded in there, so there's no difference in the rates or the plans. And all the plans have embedded deductibles with the exception of the Silver HSA, which is an aggregate. Podiatry and acupuncture are covered, but they both require prior authorization. Private duty nursing and bariatrics are not covered. And something new for 2015 is that we are promoting the alternative medicine discount, which is through My Health Community, which can be found through their My Health Online account that all members of ours can create. I'm sure you all know the difference between aggregate and embedded. This is just for your reference. If you have any questions on that, let me know. So to get into the plans, I mentioned that we are going to have a catastrophic plan. These have an age band, so they have to be under the age of 30 before their plan year. Lower premium, higher out-of-pocket. Their deductible is higher. But with our plans, we also like to include 3 visits to the primary care physician that are not subject to the deductible, and they're with a $30 copay. So with these types of plans, most of the time, everything is co-insurance. It's expensive, so we don't want people not to go to the doctor. But, you know, any more with some of our winters that we have, the flu and pneumonia, it is good to go see the PCP, so we are allowing them to have the 3 PCP visits. And, you know, I'm sure you're familiar with these. These are built for a just-in-case type of a coverage. Our 2 bronze plans that we have are $5,500 and $6,000. These have low monthly premiums, higher costs at the point of service, and the primary care visits are not subject to the deductible. The generic prescriptions not subject to the deductible as well. So a lot of these plans, like we said before, have a lower monthly premium. Someone that's not looking to spend a lot of money but would still like to have something in coverage but might be too old for a catastrophic plan, this could be a good fit for them. Our Silver HSA 2000. This is our qualified high deductible plan. The HSA members, they don't pay taxes on the money they put into the account. So like I'm sure you're all aware of, this is a great way for people to put money away that is tax-free. It is an 80-20 plan with a $2,000 deductible, and cost share reduction plans are available for individuals based on income level and household size. So that would be for healthcare.gov, anyone enrolling there. Just a reminder, anyone that's enrolling directly with us would not be eligible for a cost share or a subsidy. In our HSAs, they are administered through Benefit Wallet, which was also known as ACS Mellon. So if someone decides to open up their HSA account and they would like us to administer it, it would be through Benefit Wallet. Of course, we do know people have relationships with different third-party administrators, so they can do that as well, or not open one up at all. And this is a different type of silver plan that we are offering today. This silver plan does not have a deductible, and it only has co-payments, no co-insurance. You know, we know from the group side we have some people that just like to know what they're paying every time they just want to pay a copay. But with this, they have to keep in mind that we do have higher co-payments for hospital and ER visits. As you can see, the $600 for the ER, $1,000 for outpatient, and $4,000 for an inpatient. So it is fairly expensive. But if you are looking, maybe you don't use your plan too much, but like I said, you just want to know what you're paying when you go to the doctor. It is intended for the individuals who want to be more predictable on what they're paying. And again, the cost share reduction plan is available for individuals based on the income level and the household size. And there are other two silver plans, and these benefits are not subject to the deductible: the PCP specialist, copay, PT and OT, and the RX. The cost share reduction plan is available for individuals on the income level and household size, so again, on the marketplace. And our gold and premium plans, so as you know, these are going to be our richest plans that we offer. You know, I was really taking a look at some of these plans more today, and I'm thinking that the gold, 500 and 750 are going to be probably one of our better selling plans. I'm sure, again, the platinum will be one of our popular plans, like it was last year, depending on the situation for everyone. So we have lower cost shares, higher premiums, obviously, than the bronze and the silver. But, you know, we do see some groups that, you know, even though they might be able to keep their medically underwritten renewal, they may want to still just go with an individual policy if they're a small group. So we have these types of plans that we're thinking might be attractive to people that are coming off a group plan, since they do work very similar to our groups. And here, like I mentioned, with the subsidies and the tax credits, I personally do not handle anything on the marketplace. I work with producers that do, but I do not personally enroll anyone on there. So if you do have issues when you are enrolling someone on the FFM, you will need to go to them to assist you there. But these are what the advanced tax credits would be for this year, and the cost share subsidies. I know last year we had a nice one-page flyer that had all of this on here, so I'm sure we're going to be printing all of that information as well. So the new business applications for ICA, individual, and family. Everything's going to have the same look and feel, and I am going to mention up front that we still, when it comes to all of our producers, they all must be submitted through our portal. We are not going to accept any paper applications here for us to process for you. All of our agents, whether you work for a general agency or not, have their own login. So we're not going to worry about where they were sent, when they were received, if the right information was put in. So of course you can still use the paper application and have your client fill it out and bring it back to you, and you could submit it, but nothing is going to be sent here for us to process. Everything as far as our site's concerned is going to be the same. There were some enhancements and additions, but nothing too major. But something that is different that is going to be really nice for this year, last year we were held to the 15th of the month. to have everything in for the following month effective date. So members can now apply up to the end of the month for an effective date of the first of the following month. So they have an example here. If you apply by 12/31/14, you can have a 1/1 effective date. It is important to note that if this happens and is not accepted until the 31st, the claims process system will not be updated in time for anyone to use their benefits on the 1st. More than likely, if someone does use benefits on the 1st, it would be the pharmacy or the emergency room because those places would be closed for the holidays. So keep that in mind. But if you are enrolling anyone on the SFM, they are still being held to the 15th of the month. So keep that in mind. So for the confirmation of enrollment, there's only going to be one letter generated per application group. So last year we had a letter for everyone in the family. So if there was 7 people in the family, they each got one. We figured it was a lot easier just to have the total family premium on one, and it includes the individual premium. And all the members will be listed on there as well. This change will also be to effect for the renewal. And this is some of the enhancement on the filters. If you know a particular network that you're looking for, you can filter it that way from the metallic level, coinsurance, and plan type. So that's just the difference here. For the electronic signature, you need to make sure that you are checking this box here. So there's just some added personal information on here. And by doing this, this is allowing them to receive your policy through whether you, I'm sorry, let me back up. By doing this, instead of receiving the policy documents in the mail, this will allow you to access it via the My Health Online account, so you're not getting, all this paper. It's easier. You can go in and refer to it at any point. But if you do prefer to have it as paper, that's fine too. And some of these questions that were added on here, again, these are not going to be applied to the individual whatsoever. These are optional. A lot of this is just more so we have some data on this member. So, we can see maybe the types of things that you're looking for. Do you think that your health, you're in good, like what your health is compared to other people your age? If you're looking to, work out more, you have a lot of stress, and you need to have some more information on that. That's how we can see what information we should be sending you. This is just the piggyback off of it. This is just to show which person in the family, if you have a family of 5, who are you talking about in here. Again, these are optional. You do not have to do it. And the e-signature page. Before we had every person's name on there. So again, it could take long to go through, but it's only going to be the subscriber that has to have an e-signature, no matter how many applicants are on there. So like I said, I don't handle any of the renewals, so I did just want to touch a little bit on this since it is important to know. Since the ACA compliant plans are based off the calendar year, all members are going to have to enroll in new coverage for 1/1/15. The renewal periods for on exchange are November 15th to December 15th. And like new sales, we are going to go until the end of the month, so November 15th to December 31st. All the plans for 2015 will not be offered, so they will be mapped to a new 2015 plan that is closest to what they currently have, but obviously they are more than happy to shop and look at our other plans. If we don't hear anything, then we're just going to automatically enroll them into the plan that we map them. And it says below just that the way we are mapping them will depend on their metal level that they're currently in. So this is what they can do if they're on the marketplace, the subsidy eligible members. What do they do at renewal? They can either do nothing or they can shop for a new plan. Like I said before, keep in mind that everything must be done by December 15th, and all of these must be completed through healthcare.gov. Again, how do marketplace members renew? They can log on to healthcare.gov. They can either create an account on UPMChealthplan.com, which is the My Health Online. they can call the account manager, or obviously, which I think is the best choice, is contact your producer or insurance agent. If you work with them from the beginning, you guys know everything better than they do. So, if you know who your clients are, I would reach out to them, let them know that letters should be going out this week since the 15th is coming up on Saturday. These are for the off-exchange ACA members. They will be auto-enrolled into a new 2015 plan at renewal. Again, that's if they do not make any changes or shop to see what other plans are available. There will be 2 plans from 2015 that will be available that if members are currently on the Essential Bronze and the Enhanced Silver, they can keep it into 2015. But like I always say, they're encouraged to shop our other plans to see what else is out there, but they will not be forced to move from those 2 plans. And those are the only 2. For the 2014 plans, they will end on December 31st, and 2015 will be on 1/1. Automatically will begin. Again, if you do not make any changes, it will be auto-enrolled, but if you do want to look at the other plans, you do need to go in and make that election. Since all of our members are already signed up for auto deduction, the new premium will be deducted in December for January's premium. So whatever is on file at that point, that is what we're going to use. Because as a reminder, we do not send any bills out. We do not accept any checks. You must be enrolled in an auto renewal and an auto deduction for your credit card or a checking account. And here is the, like I talked about, the My Health Online. All of our members are encouraged to create an account like this. I think it's cool because you can go through and check all your spending, your claims. You can elect to have your EOBs not mailed to you, so you don't have those big stacks of paper. They can all be found on there. But here you can also go and make any changes that you might need. So here where it says coverage and benefits, go to make a change, coverage changes. So an option for them. And I talked about we'll be letting the members know. Letters will be mailed to the subscribers prior to the 15th. Like I said, they'll be going out this week since the 15th is on Sunday. Emails, if an email was in there for the subscriber, an email will be going there as well with the PDF of the renewal letter. And if the member has not logged in to complete a renewal by December of 2015, the subscriber will receive a reminder email. And of course, we'll have producer updates that will be going out to remind them they need to make sure they are going through the renewals and having those closed out for these members. Some rate changes. So like I mentioned, just like on the small group side, if a member is currently in a medically underwritten plan, at least they will be able to keep their plan at least through the end of 2015. They cannot change their plan at all. They will have to take a rate increase. So that is for anyone on the value, savings, or goals plans, and they will be effective for 1/1/15. They will also receive a letter in the mail in November informing them of the rate change. I'm not sure if it was just one certain percentage or it was varied between different members. Again, like I said, I do not handle the renewals, but this is, if they at least want to keep this, it's an option. But obviously, if they look at the ACA rates and they see that it's better for them, they are more than welcome to move to a 2015 ACA plan. But just keep in mind, once you go to ACA, there is no going back to your medically underwritten plan. So this is just quick on how you're shopping through 2015 ACA compliant plans. It is easy for them to switch. They would just start by clicking on the Shop Now button in the blue manner right here on the member dashboard, and they'll be able to see all the 2015 plan options, and their member ID number will stay the same, and the option to change to a new plan will be available to the members during the open enrollment of November 15th through February 15th of 2015. So that's all that I have for the slides right now. I'm not sure if you wanted to open it up to questions after this, or you wanted me to go to the producer portal, whatever you feel is best.
We do have a question about how to handle enrollments from a producer's office, so I think that would be good for producers to go through.
As far as the website?
The website, yeah.
Okay. Let me pull that up. The information. They told me it should work today, so. And the test site can work a little slow, so I apologize. So here is what the landing pad looks like. So once you go in, excuse me, you'll be able to see your member search by name, date of birth, effective date, and everything will populate here. They talked about the renewal search. This is where the renewal search will be. You'll click here and all your renewals should populate. But again, you know, I'm on the sales side, so we're just going to focus on the get a quote section. So you'll hit get a quote. And then here is where you'll go down here. I'm just going to do the 12-1 just for the sake of it being able to go through. The person's name. If you can get their email address, that's helpful because, like I said, you know, come renewal time, that is what we will use as far as, you know, if we want to email a subscriber, but sometimes it's better than having the broker email in there only because whenever we do pull their invoice, whenever we do pull their premium, we do send an invoice saying that we did pull their premium. So we'll just do today's date. Whether a smoker or not. And it's important to keep the zip code.
Cathy, you used 1877 for birth year.
Oops, thank you. I'll change that. Let me, crap. Sorry. Can't believe I'm going to put that in there. So I did it here. Let me just delete that. So it's important to keep in mind when you put the zip code in, make sure you click on it so the county populates. Because if you don't, then it'll give you an error if the county isn't in there. So just keep that in mind. And I'm sorry, it does work. It's normally faster whenever you're submitting applications, I promise. Okay. So here, hang on, maybe I should change it. Only because you won't see the new plans for anything. Sorry about that. At least the changes, so. And they did mention on the webinars that the rates are available to view on healthcare.gov and our website from the shopping tool. And I believe Jessica was taking a look at that today. So you know, our rates aren't hidden at this point, which is nice because it's not the 15th, and you know, we're just releasing everything. So here is the difference that we talked about. Like you can go through the networks, the metallic levels, or if you want to look even just on the plan side, if you want to go with an HMO or a PPO. Keep in mind, depending on where they live, so this was for Allegheny County. So Allegheny County is eligible for all three of the networks. So keep that in mind when you're looking at it. So I'm just going to pick the select. I just want to look at the select one. You can see this. And with the shopping, or with our site, it's like your online shopping. So you want to make sure that you are looking at which box you're clicking. So make sure you click it, and then you hit Add to Cart. So then from there, you can go to the next page. And also with our dental that we have, we do have individual dental through Dominion, and they can only add it on during the time of the sale or the renewal. And if they do not add it at the time of sale, they have to wait till the renewal. So here is where they can elect their dental option here. Again, you would want to click on it and hit Add. It also allows you to find the dentist. And you can click to the next. And since you'll be doing this during open enrollment, there isn't going to be any time lapse. You'll submit it, and it'll come back and say you can go in and accept. So something to keep in mind that they pointed out to us is that you want to make sure when you are electing plans. So, you might have wanted to look at a couple of different plans, and you would have 3 of them here, but you said, well, you know what, I want to go with the gold 500. Make sure you're clicking on this, because if you don't click on it, it's not going to be added, and then you'll get to the end and say, oh, I don't even have my medical, or I don't have my dental plan in there. So here we'll give you a little summary of what you're electing. You'll do the producer statements. You can either click through the next if you want them to do it, or if you're going to continue to do it for them. So like I said, you have a paper application, and they fill it out, they bring it back to you, and they say, hey, Joe, here it is. You would do it. You also have an option of emailing the benefits to them. So you have someone that says, you know what, I'm really good at this, just send me an email and I can log on. The nice thing with this is that you can write your own personal email to them and say, hi, Bob, here's the plan we were talking about. Please follow the link below and call me if you have any questions. You can put your own phone number in there so they know who to call. Here you can elect what you want to send them, just the summary of benefits and coverage for all the plans, a cover sheet, just any other marketing material. You can do that as well. Although I do have a lot of brokers that are very particular about everything that they do, so they want to make sure they're hands-on with all of their clients. Okay. Sometimes it lets me go back. Maybe. Oh wait. Instead of plan details, maybe it'll take me back. Yeah. Like I said, if you're a producer that would like to continue on for them, you'd hit producer statement and click the next box. And then from here, you would just put in their basic information. You have to make sure you have their Social Security number in there, email address, it's the same. Make sure you have everything. Where am I missing them? Phone number. Okay. And then this is the eligibility status. Because right now, it's still considering it to be open enrollment. So you would need to click through here. I might have to click yes on one of them, yeah. So more times than not, you can put if there was a divorce. Make sure you check who it was. In the past 60 days, so this is for a 1-1. But remember, during open enrollment, you won't have to do any of this, any of the special election stuff. And if you had any documents you wanted to upload, like, you know, for the special election, we're not required any of it, but some people like to put it in there anyway. And then here's just reviewing all the information. If you need to change it, plan choices that they made, you can always edit. And then here's where you've just acknowledged that you've read everything. Name. And you would submit. So here's a thank you for submitting. You can download or print the app so you have a hard copy of it. You go back to member acceptance. And then here's where you would either decide to waive for your medical, waive your dental. You go back to the application summary, accept the coverage, withdraw, change your medical plan, or change additional benefits. So this is where you would do it. You would hit enroll. You would accept the coverage. And then this is where it would give you your what your summary would be for your premium. Go to make a payment. Then here's where you put your credit card, debit, or ACH information. Once you hit next, you would confirm, and then it would tell you that you've been enrolled, and they would have a member ID right from there. So this is a very simple process to enroll someone, especially since they're not asking for any medical questions. So, and I think our site, we've made it pretty easy, user-friendly as well. So, any questions here? Do you want me to move on to the producer portal?
No, I think that was it for that.
Okay. I just want to go through the producer portal, though, just because that's like the easy way to log in. So you would go to upmchealthplan.com. Make sure you're going to the health plan. And from here, you go to producers. You would log in. So we'll also be updating like our benefit grid. So like currently, we don't have any of our individual stuff up there yet. But to keep in mind, if you go to the Resource Center, and everything should be posted up here, you know, within the next, oh no. Did something just cut out, or?
Yeah, it's just all black now.
Oh no, I don't know what happened to my computer. Well, I guess I can't show you that part of it. I can send you screenshots of it. I have no idea what happened because everything's still on. I'm so sorry. This is so embarrassing right now.
Yeah, computers.
Right. I can, if this doesn't come back on, I can definitely send screenshots of where they can find it. But pretty much from the producer portal, you would just go to the Resource Center and you would go to quoting for individual. And you would go to start a new quote, and it would be a single sign-on to the INF portal that I just showed you. So it's so easy to log on and off. The producer portal also has marketing material on demand, so if you want to have any of the plan brochures ordered, the applications, things like that, once we have those all on there, they can be shipped to your office. So it's nice to have that all on hand as well. So my computer might have actually died, but it had a full battery in it. So I'm so sorry right now, everyone. I'm totally embarrassed at this didn't.
I think you got through it all. That was pretty
I
good.
think I got through all the important parts, so at least I can answer questions. If there's questions that are being typed in, I can't see it. I'm sorry.
No, I think I went through most of them. So it was all good, and there's just a poll up if you would like us to contact you. If you have additional questions or anything and you would want us to get back to you, then let us know.
Yeah, absolutely. I mean, if they have questions about anything, if any of them are within, my area and they would like me to meet with them, I can do that as well. Whatever works best for them. So, but I just want to make sure I'm answering all questions for anyone.
I don't see anything. Anybody has any questions, feel free to type them in.
Yeah, don't be shy.
But I don't think there is. So thank you, Cathy.
No problem. And, if you ever need to do another one of these, I'm more than happy to do it. Questions, let Jessica know, and I will address them whenever I get them.
All right. Thank you, everybody.
Thank
Have
you.
a good afternoon.
Good luck selling. Sell a lot of UPMC.
Yes.
We look good this year, so hopefully it goes well.
That's great.
All righty. And I think there was a producer blast that went out right before I started that has the PDF versions of, I think there's rate sheets, plan brochures. There might be an application on there. I didn't have a chance to look at it yet. But those are all the producer versions of everything on there. So it'll say contact your producer. So yeah, that'll be on there. And once we have hard copies of everything, I'll let you know whenever you can do some ordering.
Okay.
Okay?
Sounds great. Thank you.
All right. Thank you so much. I'll talk to you all soon.
All right. Bye.
Bye-bye.